Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I'm your host, Toni Elhoms. Welcome to episode 51 of the podcast. Today is December 21st, and wow, guys, what a week I have had. My entire family has been completely wiped out with the flu, so I apologize if my voice sounds a little crazy. Thankfully, I am on the mend. I'm feeling much better, but this past week has been really difficult. And one of the hardest things about owning a business is that the show must go on. There's still presentations, litigation work, podcasting, all of the fun things that come with running a business. And then, of course, being a working mom, you don't get to take the week off because you're not feeling good. Your kids still have to eat. Your kids still have to live. So to say that this week has been hectic for me would be an understatement, but I'm here and I'm glad you're with me. So today we're going to cover prolonged services and the changes that are coming in less than 10 days. So if your organization renders these services frequently, you definitely want to get in the know on what these changes are. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip. And it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering an exclusive special to Alpha Coding Podcast listeners, and that's $125 off the Certified Risk Adjustment Coding Prep course, which has a 100% pass rate, by the way, when you order through our affiliate website. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. So our Mindset Monday tip is all about the importance of helping other people. So the quote I want to share with you says, "Help others achieve their dreams and you will achieve yours." By creating opportunities for other people to grow and excel in their career, you're actually achieving your own goals and aspirations. I remember when I made the transition from just being an employee to going into management, and I remember it was almost like a switch. You had to change your way of thinking because it was no longer just about you and getting your stuff done. You now were responsible for leading a team of people and making sure that they got their stuff done. So by mentoring and pouring into other people, you're actually growing yourself because you're showing that you can duplicate success in other people. And that is an invaluable skill that employers look for. So when you achieve that next milestone in your journey, reach back and pull someone else up. It's so important to give back and help other people. It's not only important, but it's incredibly rewarding. So today we're going to cover my top 5 pro tips for mastering prolonged services in 2021. And there are a lot of significant changes in this section. So this is definitely an area where you want to immerse yourself in these changes, not just through this episode, but you want to actually crack open that CPT book, make sure that you understand the guidelines and how these codes are applied. So prolonged services are designed to capture the additional work that goes on before, during, or after patient care. So there's different subcategories of prolonged services. So if you're able to crack open your book or pull up your encoder, it will probably be helpful for you as I'm going through these pro tips. And this brings me to my pro tip number 1. Know the different types of prolonged services. So there's provider non-face-to-face prolonged services, there's provider face-to-face prolonged services, and then there are the new prolonged service codes for 2021. And then there's also prolonged clinical staff service time. So the provider non-face-to-face prolonged services, that's going to be CPT codes 99358 and 99359. And then for the provider face-to-face prolonged services, those are going to be CPT codes 99354 and 99355. We'll talk more about those in a minute, but those are still valid for 2021, although the application is going to look a little different. So check out the new CPT code 99417. So that's going to capture each additional 15 minutes of service time that's performed on the day that the patient is seen, all of that time collectively represented in that code, and it is a per unit code. It's also important to note that this code can only be reported for CPT codes 99205 and 99215. So they can never be reported for 99214 or 99203. They can only apply to these 2 codes. Well, as we all know, Medicare likes to keep things fun and interesting, so they decided they didn't like CPT's definition of 99417, so they created their own HCPCS code, which is G2212. This is going to be really confusing for a lot of folks because the time times are going to be different than what the CPT times are. So basically it's the same code, but it's going to require additional time than what CPT requires. I'm going to give you some ideas on the number of minutes that would need to be spent to report each of these codes, but it's important that you understand the different subtypes of prolonged service. So 99417 and G2212 are going to be the new codes for 2021. And then of course we have the prolonged clinical staff service, and those are going to be CPT codes 99415 and 99416. Those codes are also valid for 2021. Important to note, we cannot mix and match clinical staff time with provider time. Pro tip number 2, understand the new time-based coding methodology. So time is not the same in 2020 as it's going to look in 2021. As we all know, the leveling methodology for evaluation management services is changing. One of those changes has been going from a single time threshold to now having time ranges. This is going to affect a lot of different areas operationally within your organization. So you want to give this some thought. So the really significant change here is that a lot of activities that happen behind the scenes are now going to be able to be captured with total time for that provider on that day. So it's going to be the total time spent on that date of service. And these new activities can now include preparing to see the patient. So doing chart prep, you can count the counseling and education for the patient, a family member, a caregiver. This is going to be huge for pediatrics and geriatrics, where caregivers and parents and guardians actually need to get the majority of the counseling. But that's created a lot of confusion. So it's really nice to see that they're going to be more inclusive of everyone involved in the patient's care. You can also count time ordering medications, tests, procedures, and here's a big one, documenting clinical information in the medical record. So I've always told providers you can't count that time. In 2021, you're now able to capture that time. So basically every minute that's not captured in another service that's dedicated to that patient on that day can now be captured. So this is really good for providers because there's a lot of work that goes on behind the scenes that they're not currently able to capture, that they will be able to capture in 2021. So it's imperative that you understand the new time-based coding methodology because that's going to impact the coding for prolonged services. Pro tip number 3, know how to apply the new prolonged service codes. So I talked about CPT code 99417 and code G2212. So these codes can only be used with level 5 office visits, so new and established patients. It's also important to note that you have to fulfill the entire 15 minutes to report it. So you can't do half of it, like there's the rule of 8 or maybe doing 7.5 minutes. That won't qualify. It has to be the full 15 minutes of service time. Also important to note, these codes are per unit. So if you have 4 units of the code, then you would need to report, for example, CPT code 99215 with 99417 times 4 units, or whatever the number of units might be. So let's go through a few examples. So if you were to report CPT code 99205 and 99417 times 1 unit, that would require at least 75 minutes up to 89 minutes total time for that patient. And then if you were going to report CPT code 99215 and 99417 for 1 unit, that would be the established patient code. That would require 55 to 69 minutes. So here's where it gets really interesting. Medicare decided they didn't like the time ranges that CPT provided. So for example, 99205 and then the G code G2212 times 1 unit would require 89 to 103 minutes. That is a significant difference from what the CPT cross code would be, which is 75 to 89 minutes. So there's a huge variation here, which means cross coding is not going to be a one-to-one match. And then for that established patient level 5 and G2212, that would require 69 to 83 minutes. So the CPT version would require 55 to 69 minutes. So again, there's a disparity in the number of minutes that are required, which is going to create a lot of confusion. So you definitely want to put some system edits in place to flag these so that you can automatically review them because they're not going to be a one-to-one match. Pro tip number 4, verify payer policies on prolonged services. So not everybody's going to follow Medicare. Some are going to follow CPT. So if you've got a high Medicare Advantage population, you want to make sure you identify what their policies are on prolonged services. Same thing goes if you have a practice with a high work comp or auto carrier population. You want to make sure that you're verifying all the payer policies because they're not all going to be the same, and you want to make sure that it's customized to your organization. This is going to be critical not with just prolonged services, services, but also with the E&M coding guidelines. Because some carriers, like for example, state work comp carriers, are saying they're still going to use CPT code 99201. So you have to make sure that you give yourself enough time to get up to speed on what your payer policies are. Pro tip number 5, audit prolonged services regularly. So as with anything, clinical documentation is critical. Keep in mind, CMS has always required stop and start times for prolonged services. So it's a reasonable assumption that they would require it with G2212, this new prolonged service code, and other payers may require it as well. You want to make sure that you have documentation protocols in place to capture stop and start time, and your providers understand that when they're seeing a Medicare patient versus a patient that has Anthem Blue Cross Blue Shield, the coding may look differently if they get into prolonged services. I have a feeling this is going to create a lot of headaches in the industry. Also important to keep in mind, the CPT codes 99358 and 99359, which represent the non-face-to-face prolonged services, those are still active, but they can't be reported with any of the office visit codes. So their application has changed a bit. You definitely want to take a look at those guidelines. Also, for the face-to-face prolonged service care codes 99354 and 99355, these are also still active, but can no longer be reported with the office visit codes. So definitely take a look at these sections because the applications have changed. So grab a pen and paper to summarize my top 5 pro tips for mastering prolonged services in 2021. Number 1, know the different types of prolonged services. Number 2, understand the new time-based coding methodology. Number 3, know how to apply the new prolonged service codes. Number 4, verify payer policies on prolonged services. Number 5, audit prolonged services regularly. So it's time for this week's coding pro tip, and it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today and visit projectresume.net and mention my code ALPHACODING for special pricing. If you have a coding-related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Ohio. Hi, Toni. I work in a busy internal medicine practice, and we are currently training our providers on 2021 E&M coding updates. And one of our providers mentioned that he was going to stop documenting comprehensive physical exams on new patients, as he feels it's rarely necessary and it's no longer required for coding. How would you respond to this? So I think it's important to give your provider some context on these changes, because the provider should understand that the documentation practices should never be driven by coding. They should be based on their clinical presentation. And although the patient's history and physical exam are no longer required for the leveling of the evaluation and management service, they're still critical to giving an accurate picture of what's going on with that patient. So in an internal medicine practice, I'm sure you're dealing with patients that have all types of chronic diseases. And I would imagine that they would be performing at least an 8-organ system exam on patients that have multiple chronic conditions. So again, I would just try to refocus it back to, it's not about what the coding requires in terms of documentation. It's about what's clinically relevant to the patient. Giving us that accurate representation of what's going on with the patient is absolutely critical, not only for clinical documentation and continuity of care, but also coding, reimbursement, and quality. So I would just continue to refocus it back to comprehensive clinical documentation is a part of the patient's care. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.